Joining me today on NYSE Floor Talk is Lucy Perez. She is the senior partner at McKinsey & Company and co-leader of McKinsey Health Institute. Lucy, it's wonderful to have you here. Thanks for joining me today on Floor Talk.
Thanks so much, Judy. It's my pleasure to be here.
So I want to start off by learning more about you. Tell me about your role and the McKinsey Health Institute.
Thank you for that. I am one of the co-leaders of the McKinsey Health Institute, which is a mission-driven entity within McKinsey, where we're focused on the question, how can we add years to life and life to years? And so within that work, we are very focused on questions of health equity, and women's health is one of those questions that we like to explore further.
Lucy, in your latest report examining the women's health gap, that women spend 25% more time in poor health than men, is helping change the conversation on women's health. So tell me more about what this latest report found.
Yes, what we wanted to do with this report is really address a lot of misconceptions that exist around women's health. We oftentimes think that because women live longer than men, which is one of the facts, that they're actually healthier. But what our research has shown is that despite living longer, they actually spend much more time in poor health. That's on average 25% more time. And so when you look at this, the other misconception that tends to exist is that this poor health is concentrated at the end of life. But actually, the majority of this health gap is happening during women's prime working years, between ages 20 and 60. As a result of that, it has huge economic implications, because this is keeping women from being able to make more choices about how they spend their time, how productive they are. And so what we wanted to do with this research is quantify the economic opportunity and the health opportunity, because the two of them go hand in hand. And if we close this gap, we're talking about giving women on average 7 more healthy days every year. And collectively, we're talking about adding over $1 trillion of annual contribution to the global GDP. So pretty staggering numbers.
Now, what are some of the root causes of this disparity, and what is the opportunity for society and business leaders to address it?
Yes. I'll start with the opportunity, because frankly, that's what got us excited in looking at this data, right? And it is this idea of women having more time in good health. And as a result of that, the economic contributions that come alongside that, right? Like that $1 trillion in economic opportunity globally. I will say in the US, we're talking about close to $300 billion in annual contribution to the GDP. As with anything of this scale, there's complexity. So there's multiple reasons that are driving the gaps that we see. I would say the first one is the gaps in understanding sex-based differences in biology. Too often we think women are just small men. Take the same, male anatomy, just make it lighter, make it shorter, and you've got a woman if you change the reproductive organs. But if anything, what we've learned more and more as we've started asking more often the question of, are there sex-based differences, is that male biology and female biology, there's a lot more differences than just the reproductive organs. And so it becomes really important that we actually refresh the definition of women's health to not just be what are those conditions that impact women specifically, but actually also those that impact women differently or disproportionately. So in addition to that limited understanding of what those differences are and how they manifest, we find that there's a lot of limits in the data that exist around women's health. So for example, some of the databases will lead you to think that actually we only have 1/10 of the patients who are suffering from conditions such as endometriosis. The reality is endometriosis, for example, impacts 1 in 10 women, about the same prevalence that you would see in diabetes. But when you compare the amount of research that's going into it, the amount of solutions that exist to help the patients suffering from endometriosis, it pales in comparison to what you would expect. The other thing is, we frankly, because we have that limited understanding of sex-based differences, we're not developing sex-appropriate care protocols. And so take heart disease, the #1 killer of women in the US, right? We know that heart attacks can manifest differently for women than for men. But most of the time, actually, medical school students are not being trained in those differences. They only learn the symptoms for how they manifest in men. And too often we see the sad situation that women show up to the ER with different symptoms, and instead of being recognized as suffering from a heart attack, they're sent home thinking they have indigestion. So we need to change the education, and we need to put in place the protocols that will help get to those better outcomes for everyone. And of course, this all takes money, right? So a lot more investment is required to help close the gap.
Now, Lucy, finally, where do we see action being taken, and where do we see room for stakeholders, including business leaders, to come together to harness this $1 trillion opportunity?
Yes. I mean, the reality is everyone has a role to play, right? Whether you're in the healthcare ecosystem, you're in government, you're the average person at home watching the news, everyone has a role to play here. And I think what's really exciting to see is that we're seeing more action, right? And the action is coming both in terms from policymakers, putting a lot more attention around women's health, the need for investment, and you see different initiatives that are being announced around this. But you're also seeing it in the way that there's a lot more attention being paid, for example, in medical school curricula, to how do you incorporate this into the way that you teach and ask the question of sex-based differences that much more often. I also just get excited by the fact that there's a lot more attention given by the press, right? That we're driving a greater education of women and those who love women, right? Because the reality is when women are healthier, everyone benefits, not just themselves, but because of the primary role that women play as caregivers in society, helping them have healthier days means a stronger society for everyone.
All right. Well, Lucy, it's been wonderful to talk with you. Amazing information coming out of this report. Thank you so much for joining me on Floor Talk today.
Well, thank you so much for helping shine a light on this as well.